ఎక్కువ ఎందుకు వస్తుంది? Have you logged in? Hello? Have you logged in? Am I audible now? So, good afternoon, everyone. Today I'm going to talk about a very important concept. Maybe you still can't hear my voice. Anirudh, voice రావట్లేదు. Today I'm going to talk about a very important concept, that is the how to take care of the aging eye. Now, as we know that for any cell in the human body, there is a biological clock. So this biological clock is going to follow its own course, and of course there is a huge variation in what happens with the biological the aging of the cells, and this enormous variation depends on our own lifestyle. So, for example, toxins in our diet, like a lot of fat or sugars or caffeine or alcohol or nicotine smoking, can lead to abuse of this system and quick wear out of the cells. There is somebody who has probably never smoked a cigarette or has been eating a lot of healthy fresh fruits, vegetables, will probably the onset of the wear out will be much later on. However, it doesn't mean that the wear out won't happen because we are following the clock. Now, based on this biological clock, what are the changes that can happen in the eyes that happen as a part of the aging process? And what are the changes that may happen as a part of other diseases that happen in old age? Now, if we see that in the eyes, we have the lids and the lacrimal glands. Now, the lids are normally having a particular position, and the upward movement of the lids is by the help of a muscle. Now, this muscle may undergo atrophy with age, and thereby it allows the prolapse of fat, which is cushioning the eyeball, to come out. That is called fat prolapse. Now, that leads to somewhat sagging or sort of fullness in this area. That is called blepharoptosis. This is again part of the normal aging process. And other changes such as upper or lower lid laxity, wherein the lids fall away from the eyeball. Normally, they are all touching the globe very closely, but they fall away because of the laxity of the skin and tissues. These are also part of normal aging process. Now, other things such as tearing, watering from the eyes may be more common in the elderly. Blockage of the nasolacrimal duct that drains all the fluid from the eyes is also common in above a certain age. Now, the next part of the eyeball is the cornea. So, if we see here, the cornea is the clear, transparent front part of the eye. So, this cornea with age, what happens is it may lose its luster. So, it may become like not so shiny. It may have increased sensitivity to wind or to dust, and it may become more fragile. So, its response to injury may not be that robust. Now, the other very normal part of aging is the appearance of an arcus or a white ring around the cornea. Now, this white ring is typically seen in normal individuals above the age of 60 or 65. It starts somewhere in nasally and then progresses all around the eyes. Now, the next part of the eye is called the trabecular meshwork. So, this is where the cornea meets the iris or the pupil. This is called the angle. So, now in the angle, we have something called the trabecular meshwork, which filters all the water inside the eye. And in that area, we can see increased amount of pigmentation or the increased amount of the pigments that are inside the eye. Also, the pupil may become very small. So this the small aperture, which allows which allows light to go inside and focus on the retina, becomes small and rigid. So, because of the decrease in the tone. So, now these are the changes that we see in the anterior part of the eye. Now, the next part of the eye is the lens. So, what we saw in the front part of the eye, we have the cornea, we have the iris pupil, and then behind this we have the normal crystalline intraocular lens. So, this is our God-given lens. In our young age, we have the lens which is very transparent. So this transparent lens along with the cornea behaves as a perfect system which again makes the light go inside the eye and focus on the retina. So now once we have a clear image that is owed to both a clarity of the lens, its flexibility and also the corneal clarity. Now with age what happens is this lens becomes less flexible, more rigid. So if it becomes more rigid, what happens is the ability of the eye to change its power reduces. So the first thing that we see is near vision can become a little difficult for us. So for example, at the age of 40, if we stop seeing objects at this distance, that is because the lens has lost a little bit of its flexibility to change its shape. So this progresses and it's a mathematical process scientifically. So as the age goes up, the near vision reading glasses number also changes. For example, at 40 it is +1, at 45 it will be +2. So now this is the first change that happens in the lens, that is decrease in elasticity. Subsequently, there are also changes because these are all live cells. So as the cells become older or undergo certain changes, the lens will no longer remain transparent. The lens may become like this, wherein the central portion of the lens may have some opacity. This is called a posterior subcapsular cataract. or it may just simply change in color. This is called a nuclear sclerosis. Now, the nuclear sclerosis or the posterior subcapsular cataract are all the initial grades of cataract. Similarly, we may also have only cortical cataract, wherein only the peripheral lenticular area becomes white. These changes, as they progress, they become into a mature or a full cataract, total cataract. Now, any type of cataract, either early or late, requires surgical replacement as of now. So what we do is we remove the cloudy material from inside the capsule of the lens and we replace it with a artificial lens. So it looks something like this. So this artificial lens sits inside the same bag that God has made, and then it gives us the similar function to what our natural lens was doing. So this is the next change, age-related change that happens in the eye. Now, next we have the vitreous. Now, this is the eyeball, and the eyeball inside is a cavity. This cavity is filled with two types of fluids. In the front part, it is called the aqueous or a watery layer, and in the inside, it's called the vitreous, which is a gel-like layer. Now, this vitreous jelly, as with age, undergoes some sort of shrinking. So, suppose if you have a bowl of jelly and you keep it in the refrigerator, it will undergo some shrinking as with time. Now, because of this jelly undergoing shrinking, what happens is this vitreous jelly normally has attachments to various parts inside the eye, very very flimsy adhesions. So, like you have attachments to these blood vessels, you can see the blood vessels, or if you can see this choroid or this pink part, there is a pigmented part of the eye. It has attachments over here also, and if you can see inside the eye, you have the optic nerve over here. So the optic nerve, and around the optic nerve, it will have some adhesions. Now, if the jelly shrinks, these adhesions will also be released. And because of the release of these adhesions, sometimes in the elderly, you see something called a floater. So it will be actually very irritating because the floater keeps moving around. As you move your eyes, it moves with your eye. But the floater actually is a very benign and a very harmless thing, and something that is not to be worried about. Only the floaters which are red in color, which may be because of bleeding, or which are thousands in number, for which may indicate a larger bleed, or if it is associated with flashes of light. Now, flashes only happens when the retina is harmed. So, for example, if the retina moves, either because of, say, the vitreous has detached from it and is pulling it, then we can have flashes of light, or if the retina has detached from its position. So, now the next part of the eye is the retina. You can see this retina is very closely stuck to the this eyeball outer surface. This is the sclera. So this is the retina, choroid, and sclera. This is this whole complex, and is very well attached to it, and it is supplied with blood vessels. Now, the minute the retina gets detached because of either trauma or any other reason like diabetes or new blood vessels, this blood supply may be lost, and the retina may become completely dead. So the retina is very pertinent for all our vision. Now, no retina detaches itself as a part of aging. This is very important. However, with age, what changes may happen is there may be decrease in dark adaptation. For example, if I go from a bright room into a dark room suddenly, then and in a younger individual, that the ability to change the focus will be much faster. The process will be much faster than in an adult. So delayed dark adaptation, that is what we call it. Second thing is the number of cells in the retinal pigment epithelium decrease with age. Also, the number of pigmented melanin cells will decrease with age. These changes lead to a reduction in the contrast sensitivity. So the sharpness of images or contrast may go down. Now again, like I said, the biological clock has huge amount of variability, and we may either be able to delay it, or we may be able to maintain it for a long time. Now, these are some of the changes that we see. Now, other important things that we must know are some of the changes which are irreversible, that occur as a part of aging, but may be treated if caught early. Now, one of the most important things in that is glaucoma. So, in glaucoma, what happens is the normal eye pressure is anything between 10 and 20 millimeters of mercury. Just like our blood pressure, we have eye pressure. Now, if the eye pressure is anything more than that, then it leads to compression of the optic nerve and the retinal fibers. Now, this compression will lead to some changes, and those changes are irreversible. Now, most commonly in the early stages in glaucoma, the patient will not face any difficulty, because if pressure today is 20 and tomorrow becomes 22, that is a very slight change for the eye or for the patient himself. And also, the changes in that happen in glaucoma are so slow that it is called a silent thief. So these slow changes are very rarely perceivable by the patients in the early stages. In the end or the later stages, the patient will have a very narrow field of vision, and this by that time the irreversible changes will have set in the eyes. So this is the first very important point, that is glaucoma. Now the incidence of glaucoma in an 80-year-old is very high, um, which means to say that all of us are predisposed to glaucoma as we age. Next thing is, how do we detect that glaucoma is there? So most commonly, glaucoma is detected on a routine ophthalmic examination. Therefore, we assert that glaucoma testing or routine eye pressure testing must be done once in a year. So, of course, if you visit an ophthalmologist once in a year, it will be done. The intraocular pressure assessment will be done as a routine assessment. Next, we have age-related macular degeneration. Now, in the center of the eye, so all the light comes and focuses at a point in the retina called the macula. Now, this macula is the point at which the cone cells or the retinal cells are at the maximum concentration, and this is the point where we have maximum sharpness of vision. Now, with age, sometimes this macula undergoes degenerative changes and faster than the other cells in the body. So, this age related macular degeneration, if picked up early, the degeneration can be slowed with the help of some certain anti aging or antioxidants in the diet, or some dietary modifications as well. The next illness that we can see that starts somewhere around 40 and above is retinitis pigmentosa. In retinitis pigmentosa, in the retina, there are clumps of pigments that are deposited. These changes are hereditary, and there is very less that we can do to prevent the changes from progressing. Now, the next important change that can happen in the aging eye is diabetic retinopathy. Again, in diabetic retinopathy, much similar to what is happening in the body, the diabetes itself is affecting the blood vessels all over the body. The advantage of being able to see the eye by various assessment techniques is that we can visualize these blood vessels, whereas in the rest of the body, we need specialized imaging techniques. Now, once when we image these blood vessels, we see that the diabetes may affect the pericytes or the cells. Each individual cell may be affected, or randomly they may be affected, leading to certain changes. Number one would be leakage. Now, this microvascular leakage of nutrients will lead to swelling up of the retina or retinal edema. Second thing, what happens is, by the time the blood reaches the end artery or the last part of the narrowest part of the artery, the oxygen is already lost because of the leakage. And because of this, the retina itself is receiving less amount of oxygen. So again, these changes up to a certain level are very much reversible. If the diabetes and the cholesterol is well controlled in the initial stages when the diabetic retinopathy has started, these changes can be controlled to a great extent. At the next level, we can still treat it with the help of newer injections called anti-VEGFs, and with the help of retinal lasers also. However, at a particular point, when the oxygen deprivation has reached to its maximum limit, we cannot, even with the use of help of best medications or injections, the changes cannot be reversed, and the patient may lose his vision completely. And the last very important change that we see in the aging eye is hypertensive retinopathy. So, for any patient who is having hypertension from a long time, the arteries become slightly stiffer, and because of the stiffness, we see certain changes in the retinal arteries and veins. And these changes may be seen in the form of, where the crossing happens between the artery and the vein. There may be a change in the caliber of the veins because the artery has become stiffer. Other problems such as branched retinal vein occlusions can happen, because of hypertensive arterial changes. Now, the next is the cardiac patient. So, in patients with heart disease, there is a tendency to have blockages in the blood vessels of the heart. Similarly, there may be blockages in the blood vessels of the eye as well, and these blockages may lead to irreversible changes. So, again, all these changes, if detected early, we may have some preventive medications, or we may take appropriate measures from the ophthalmic point of view. So this brings me to the last part of my talk. That is, what should be the normal checkup or evaluation pattern for any elderly. Now, if we say from the age of 40 onwards, assessment of the eye completely, including the assessment of the refractive error, any change in glasses, for any near vision, onset of any reading glasses, or for any eye pressure changes, and for any changes in the lens must be done at a yearly interval. This interval is more than sufficient to detect any early changes or early eye diseases. After the age of 45 or 50, or after the onset of either diabetes or blood pressure, these tests must be done a little more frequently depending on the level of control. For example, if the sugar is or the diabetes is very well controlled, the patient can continue with a yearly follow-up. However, if the diabetes is poorly controlled, then the review needs to be every 3 monthly. uh, Again, if one has already been detected as a case of glaucoma, then a 6 weekly or a 2 monthly checkup of the eye pressure under treatment is required for us, for the physician, and for the patient to understand what is the target eye pressure that he requires. After a cataract surgery, the patient can follow up every yearly or 6 monthly, depending on his visual requirements and his visual complaints in the other eye also. This brings me to the conclusion of my talk. I'll be very happy to answer any questions on life. If there are no questions, we'll finish this conversation. Thank you very much for listening to me.